Thank you. Okay, so we're looking at the shoulder for BMS 271. We're starting with the clavicle. Now this is a fairly slender clavicle, and what we can see, if we turn it to look at an anterior view, we can see that the sternal end is quite tall, chunky, the acromial end quite flat, okay, when we're looking at it from superior to inferior. If we then look at the sternal end a little more closely, what we actually want to be able to find on it is the sternal facet. Now, unfortunately with the lighting, it's not that brilliant, but if I just turn it this way, hopefully you can see there's a little smooth area here, which is the facet. Now the facet on the sternal end is not the entire end, it's not this whole surface. So only a small part of the clavicle actually is contributing to that sternoclavicular joint, and there's just this little bit here. So it's partly on the inferior surface, partly on the kind of medial or sternal end there. So it's almost an L-shaped little facet that's on two surfaces, if you like. So that's the sternal facet. Now fortunately, if we go and have a look at the acromial end, and again here we're looking at an inferior point of view, if we have a look at the acromial end, the facet is a bit bigger and a bit kind of easier to spot. Well, you can see there's a smoothish kind of bit here, that's the acromial facet. Now then, towards that acromial end, again on the inferior surface, we have a conoid tubercle, and that's towards the posterior aspect of the inferior surface. So we know that this is the back then, we know this is the posterior surface of the clavicle. And then from the conoid tubercle towards the acromial end, we have the trapezoid line. Now, as it often is, the trapezoid line on this particular bone is more of just a raised area, almost like a tuberosity. So it's a kind of a roughened patch or a raised area where the fibers of the ligament have been attaching. So we've got a conoid ligament attaching here to the tubercle, and then a trapezoid ligament attaching here to the trapezoid line. And of course both of those two ligaments together make up the coricoclavicular ligament. Now if we look from a posterior point of view at the clavicle, you can see the two bumps that are the tubercle, the conoid tubercle, and then the trapezoid line. Now then if we stay with the inferior surface, but we come up towards the sternal end, here we have the impression for the costoclavicular ligament. And it's usually a reasonable size, this impression, because the costoclavicular ligament is most definitely three-dimensional. It's not a flat or skinny ligament, and it's attaching this from here, from this impression down to the first costal cartilage. Pretty strong ligament. And then, I think lastly for the clavicle, we have a little groove in here, and on a larger clavicle, it's a bit more pronounced, but on this one it's not really a very deep groove, but that's the groove for the subclavius muscle to attach. So subclavian groove just here, where the subclavius muscle will attach on the inferior surface. So most of what we're looking at there on the clavicle is on the inferior surface. And now if we have a quick look at a scapula, here we've got a left scapula. I forgot to mention the clavicle we were looking at was a left clavicle. So here we've got a left scapula, and firstly we're looking at an anterior point of view with superior at the top of the screen and inferior at the bottom. We can see the acromion, and if we just switch over to a superior point of view, here's the acromion here, where the clavicle is going to articulate here, and a little facet there. Then we have the spine of the scapula. So from the acromion, we can just kind of trace along the spine of the scapula here, remembering of course the spine of the scapula seen clearly from a posterior point of view. It's quite easy to spot there. Then if we come back, we're looking at a lateral point of view now. There's the acromion, there's the coracoid process. So from an anterior view now, you can see the coracoid process sitting there, just a little bit below the acromion. The glenoid cavity sitting on the lateral aspect here, where the head of the humerus is going to articulate, has a tubercle just above it, the supraglenoid tubercle, and then a tubercle just below, the infraglenoid tubercle. Then we have, again, if we come back to an anterior point of view, we have a superior angle here, the curve at the top. We have a supraspinous fossa, so just here, where the supraspinatus muscle is going to sit. And of course that's above or superior to the spine of the scapula. So now looking at a posterior point of view, here's the supraspinous fossa. Here's the infraspinous fossa, inferior to the spine of the scapula. And it's this whole region, it's not just the little impression just below the spine, it's this whole region. And then the subscapular fossa on the anterior surface, where the subscapularis muscle will sit. Then we have a medial border, this medial aspect, a lateral border here below or inferior to the glenoid cavity, and then an inferior angle, so just this curve down at the inferior aspect. And now if we just quickly look at the proximal part of the humerus, here and again we have a left humerus, so we're looking at the proximal end, anterior view to begin with. This is the head of the humerus, and you can see that it's about a third of a sphere and it's nice and smooth and rounded. Then we have an anatomical neck. Now the anatomical neck is the line that runs right around the edge of the head, so we can trace it kind of all the way around. It's just a little ridge, and it's where the smooth bit ends. Then we have a surgical neck, and that's basically just here where the two tubercles and the head kind of start to taper towards being the shaft, and so when it starts to narrow, that's the bit that can break relatively easily. So that's the surgical neck of the humerus. Then we have on the lateral aspect a greater tubercle just near the head. On the anterior aspect a lesser tubercle, much smaller, a much smaller bump there. So greater, lesser. In between those we have an intertubercular sulcus, which does have other names that it does get called. It occasionally gets called the bicipital groove. And then distal to the greater tubercle on the lateral surface of the shaft, we have the deltoid tuberosity. You can see there's a kind of raised area or roughened patch just there where the deltoid muscle attaches distally, and just posterior and a little bit distal to that there's the radial groove where the radial nerve travels along the shaft of the humerus. Now it's often not really much of a groove, it's often a fairly flat sort of groove. On this one you can just see a little depression there, occasionally it is deeper.